Hello guys, how are you all? And it's been few days since we haven't met. So, all right. So we will start with this topic today, which is the oral mucositis, and hopefully we will cover this important topics today. Okay, and yeah, so we will start with that. And if you have any doubt with any topic, or if you have any question, you can always ask me. Okay. So the oral mucositis, it as the name states, so there is an inflammation of the oral mucosa. Okay, so with the inflammation, you know the signs, right? So inflammation has four signs, which is the red. So the area would be red. There would be um, pain. There would be swelling, and there would be the ulceration as well. Okay, so the oral mucositis presents as painful inflammation, redness, swelling, and ulceration of the oral mucosal surfaces, and these can be caused by radiotherapy, chemotherapy, or other drugs. How they do that? Because they lower down our immunity, and they affect the normal cells. Oral mucositis is a type of stomatitis, which means an inflammatory condition of the oral tissue. Other causes of stomatitis include salivary gland hyperfunction. So the other causes could be, so these are the main causes of oral mucositis, which is the radiotherapy, chemotherapy, and the drugs. There could be other causes, which could be if there is any salivary gland hyperfunction. It means if the patient has dry mouth, it can also lead, because saliva does contain a lot of enzymes, and it helps in even protecting our oral mucosa as well. But if there is any dry mouth, it would make a mucosa more prone to these infections and these inflammations, these reactions. Okay, and sometimes some vitamin deficiencies can also lead to these ulcerations and inflammations. So what you need to do is take a thorough history and examination to identify the cause, like which is the cause in your patient. Either it is radiotherapy, it is chemotherapy, it is any other drug, or dry mouth, or any deficiency. So you need to rule out by taking the history and doing the examination. Oral mucositis can lead to significant problems with eating. Of course, if your mouth is painful, okay, so there would be some problem in eating, drinking, and adherence to medication. Then patients undergoing treatment of cancer who develop mucositis have an increased risk of systemic infection and require longer hospital admissions. So if people are undergoing any treatment of cancer, okay, so they can also develop a mucositis, okay, and they have increased chances of systemic infection, because cancer therapy does like very severely, it does affect your immune system. Patients should be dentally fit before starting any chemotherapy or head and neck therapy. So, whenever the patients are diagnosed with the cancer or something, so before starting their medication, their specialist does send them to the dentist to make sure that he is dentally fit, because there are certain medications like bisphosphonates. If the Because the cancer patients would be taking that medication, even the osteoporosis patient as well, which is very common disease to be seen in Australia. So if that is the case, then the patient would be taking the bisphosphonates. So in bisphosphonates, you all know that it can severely affect the healing of the socket. So before that, it is very important to make sure that the patient is dentally fit, and there is no need for any extraction in the foreseeable future. Okay, and chemotherapy or head and neck radiotherapy, particularly if the treatment will result in severe mucositis and reduce salivary flow. Because each and every medication does affect the salivary flow, that they make our mouth dry. So even if with the particular treatment, like this treatment, it does severely affect the it can severely cause the mucositis and dry mouth. So that's the reason we need to make sure that our patients are dentally fit before starting these treatment modalities. Then, for more information on the dental management of patients receiving chemotherapy or head and neck radiotherapy. Then, management of oral mucositis. So, if it is palliative care, it means it is in hospital, then you do not need to do anything. The guys would do, right? Then, if in children, then seek expert advice. Manage oral mucositis in conjunction with a multidisciplinary team, which includes addressing the cause. Okay, you need to find out what is the cause in your patient. Then you need to give them symptomatic relief. It means if they are in pain, you need to give them some gel or something to apply for the pain. Okay, and oral care regimes and nutritional advices, because if the patient is in pain, so he won't be able to brush their teeth or follow the oral care regime, right? So you need to do something. Then initial and regular ongoing assessment of oral pain is essential. Lubricants and analgesic mouth solutions may reduce pain and inflammation. Artificial salivary products can be applied as necessary for transient relief of oral dryness, because there would be dry mouth. So we can prescribe them some artificial salivary product that can symptomatically help with the dryness. And which type of or topical analgesics we can prescribe? First one is the benzidamine hydrochloride, which we are prescribing. 0.15% solution, 15 milliliter, rinsed in the mouth for 30 seconds, then spat out 1.5 to 3 hourly as necessary, or the lidocaine 2% viscous solution. So you just need to remember these doses. So try to write all the doses on a piece of paper. Okay, and remember them, because even if there is any scenario in regards to oral mucositis, so if they will ask you the management, then they can give you the same name with the confusing readings, right? So you need to remember what should be the doses, how much amount, for how long. Okay, so try remember all the doses, like if not all, then most important. If pain is not adequately managed with topical measures, then systemic analgesics may be required. Seek advice from the patient's multidisciplinary team. Then establish preventive oral care regime and regularly assess the oral cavity. Patients with profound mucositis have difficulty performing oral hygiene measure effectively, though this should be encouraged. Nevertheless, still we need to encourage them. But if they are in pain, and then they would be, avoiding that. Then chlorhexidine limits exposure to waterborne pathogen and can be used when pain and discomfort restrict the oral hygiene practices. So which amount of chlorhexidine we do recommend is the 0.2% mouthwash, which is alcohol free. It is very important alcohol free, because alcohol would cause more dry mouth and would lead to more symptoms. Then 10 milliliter rinsed in the mouth for 1 minute, then spat out 8 to 12 hourly. Use diluted with 10 ml of water if stinging occur. If they find this to be more very severe, like this is causing them stinging sensation, then they can even dilute the solution and use it. Chlorhexidine gel is an alternative oral hygiene adjunct to mouthwash and may provide some lubrication and ease discomfort. So use chlorhexidine 0.5% gel, alcohol free, applied 2 to 3 times daily to all mucosal surfaces and gingival margins. Then nutritional support for patients with mucositis is very important, because they won't be taking anything, or they would be avoiding anything to eat. So nutritional support is also important. Encourage patient to avoid irritant foods such as acidic food, spicy food, salty, dry, or abrasive foods. And refer patients for specialist nutritional advice if mucositis is severe. Okay, so first what you need to do is take the history and do the examination to find out the cause of mucositis. Okay, and later on, when you will manage the patient, then you need to see what things you can give him. Like you need to give him the symptomatic relief. You can prescribe these any of these medication. Then what you need to do is oral care regime, because that is very important. For that you can prescribe them chlorhexidine for time being, but still you need to enforce the oral hygiene practices. Okay, and the nutritional advice. So you need to do these things, and after that you can take specialist advice if the mucositis is severe. Then dry mouth. Dry mouth is very, very important topic. Okay, and there are some questions which are related to dry mouth, because dry mouth can lead to more cavities in the mouth. Dry mouth can also lead to more gum conditions. So it is very important, this topic. The subjective feeling of dry mouth, which is the xerostomia, is a relatively common condition that may or may not occur in the context of salivary gland hypofunction and objective reduction in the quantity and the quality of the saliva. So many pathological and physiological conditions and drugs can cause salivary gland hypofunction or dry mouth. Which are these causes? Dehydration. If the patient is not taking enough amount of water, then there would be dry mouth. If patient is taking alcohol, then also there will be dry mouth. If the patient is anxious or is under stress, that would also cause dry mouth. And if the patient is mouth breather, that would be also one of the cause of the dry mouth, and even the drugs. So there is one Odell case. It is based on Sjogren syndrome. You guys can read that case and you will get more insight about this topic. If common causes have been excluded, investigate for less common medical conditions associated with dry mouth, that is Sjogren syndrome. Then drugs frequently associated with dry mouth are, which are the drugs? Okay, so here they have given 5 things that are related to dry mouth, but they have described which special drugs are related to the dry mouth. Like all drugs does cause the dry mouth, but these are most commonly associated. What are these drugs? Which are the anticholinergic, antihistamines, the drugs that lower blood pressure, then bronchodilators, opiates, psychotropic drugs, or urinary antispasmodic. So, I try to make the mnemonic of everything. So try your mnemonic, whatever you can, So for this, it is bit funny, and I made the mnemonic for the dry mouth as damad. So it is an Indian word, DAMAD. So I used to remember it like that. So try to make the mnemonics for everything, and you will not forget that. Okay, then dry mouth is the debilitating adverse effect of head and neck radiotherapy, with the degree of salivary flow reduction dependent on the dose and reason of the radiation. So as we read here, because radiation can lower down the saliva amount, so that is the same thing that they are stating here. And there is one case in Odell, for the patient has very severe radiation caries. So you can read that chapter also if you want to get more about radiation and the dry mouth link. And then chronic dry mouth can have a profound effect on the oral environment and can contribute to tooth decay and erosion. Periodontal disease, oral mucosal disease, oral candidiasis, difficulty with the retention of denture, difficulty with chewing, swallowing, and speech, altered sense of taste. Okay, so just try to remember it like that. Mm, like in our, because what are the main diseases in the oral cavity, which are the caries? Then dry mouth does affect caries. periodontal diseases, then oral mucosal diseases, oral candidiasis. It does affect with the denture, which is the prostho. Then it does cause difficulty with chewing, swallowing, and speech, which could also be come under prostotopic, and the altered sense of taste. So it does affect everything whatever we are using the mouth for. So it is very important that the saliva content and quality and quantity should be good for good oral hygiene and good maintenance. Then management, how would you manage this patient? First, you need to find out what is the cause. Either it is these five things or one of the drug that patient is taking. Then what effect does dry mouth can lead to their oral cavity? You can highlight it to the patient. And then how can you manage it? Encourage patient to have a dental review and any necessary dental treatment before starting a drug that can cause dry mouth. So it is very important to get a dental review to find out if there is anything that we need to do, like if the patient's medication is affecting his saliva too much, then review the patient's medication and in conjunction with the prescriber. So here there was one question, the patient has dry mouth, what you need to do you change his medication? So this is completely wrong answer, because we have not prescribed him that medication, so we have no right to change that medication. So that medication would be only changed by his prescriber, which would be the GP or any specialist. Then stop any non, you can talk to them that this medication is leading to dry mouth and which is affecting his oral hygiene. So you can talk to them like that, but you cannot do anything or any alteration in that medication. Then management strategies for patients with dry mouth include, you need to ensure that they are adequate hydration. So because the cause was, one of the cause was dehydration, so you need to make sure that the patient does take enough amount of water throughout the day. Then ensure good oral hygiene of the patient. Then regular dental examination and treatment every 3 to 6 months. So if the patient is high risk, we do see him every 3 monthly, but if the patient has normal risk, then we see him every 6 months. Then topical remineralizing agent can help in preventing the caries, and symptomatic relief would be that we can prescribe him some artificial salivary products or other oral lubricants which are bicarbonate mouthwash. However, it effects may be too transient to be of significant benefit. Products that stimulate saliva, either artificial salivary product or the products that stimulate the saliva, such as throat lozenges, chewing gums, or any. However, many products are acidic or have a high sugar content, which can cause further tooth decay. So you need to make sure that. Okay, so what are your management strategies? You need to make sure that your patient is drinking enough amount of water, he's maintaining good oral hygiene, he's coming to you for a regular dental checkup 3 monthly to 6 monthly, and he is using remineralizing agents like fluoride and maybe CPP, ACP, because he has dry mouth. So this is an additional high risk factor. And the symptomatic relief, so these are the 2 points how you can provide him the symptomatic relief. Then we will read in box 14 that would help us in giving the patient the non-pharmacological advices. If symptomatic measures are inadequate, or if a dry mouth is a symptom of systemic disease, then you need to refer the patient to an appropriate specialist. This was the line even in the red flag features as well. So you just need to do these strategies, these 5 points, and plus non-pharmacological advices. After doing this, still patient symptom does not resolve, then you just need to refer him to the appropriate specialist. Then what are the advices that you need to give to your patient? Which is to manage your dry mouth. You ensure that you are having enough amount of water, which is 1.5 liter of tap water per day. Chew food thoroughly, because that would also stimulate the saliva. Chew sugar less gums or suck sugarless sweets. Then avoid smoking cigarette because that would lead to more dry mouth. Avoid acidic food. Limit your caffeine and alcohol intake, especially in the evening. Add milk to tea or coffee to reduce the drying effect. Avoid mouthwashes and other oral preparations that contain alcohol. Trial various over-the-counter dry mouth products of bicarbonate mouthwash, like just use them by adding half a teaspoon of bicarbonate water to the glass of water, and rinse it and at any time during the day. And to prevent any oral or dental consequences, ensure that you are maintaining good oral hygiene, visiting the dentist regularly, and avoiding acidic beverages, which are the wines, fruit juices, soft drinks, sport drinks, or limit their consumption to only to the meal time. Limit your sugar intake and avoid sugary snacks. So in these points there are few things like you need to advise him to take enough amount of water. 2 points are for the chewing, like chew your food and chew sugarless gums. 2 points are for the avoiding cigarettes and acidic food. Limit is caffeine and alcohol. And in the avoid, there is one more point, sorry, which is the mouthwashes that does contain alcohol. So that's we are done with the dry mouth and the oral mucositis topic. And tomorrow, hopefully, we will start with the halitosis. Thank you so much, guys, for watching my videos. And I really hope that you guys are enjoying them and getting help from them. All right. I'll see you in next video.